If you're over 50, this is what will really happen to your body if you practice dead hang every day. About 80% of adults over 50 suffer from some type of back pain, neck pain, or nerve compression-related problems. This alarming number is no coincidence. It's a direct result of modern life that keeps us sitting for endless hours, at work in front of the computer, driving in chaotic traffic, or even during moments of rest on the couch. Our bodies weren't designed for this prolonged posture, and the consequences appear as we age. But there's a surprisingly simple solution that requires just a few minutes daily and can reverse many of these damages. The dead hang. Simply hanging from a bar can transform your health and quality of life in ways you can't imagine. Today you'll see 7 proven benefits that dead hanging will bring to your body after 50, even practicing just 1 or 2 minutes per day. Before we begin, tell me in the comments your name and how long you've been training. Benefit number 1, spinal decompression. Throughout the day, gravity constantly compresses our spine. After decades of this pressure, the intervertebral discs begin to lose height, joints suffer wear, and mobility decreases significantly. This is one of the main reasons for constant back pain affecting most people after 50. The dead hang offers a perfect counterpoint to this daily compression. When hanging, body weight creates natural traction that reduces pressure on the discs and joints of the spine. It's like giving a breath to structures that rarely have a chance to rest. The intervertebral discs, which function as shock absorbers between the vertebrae, can finally expand and rehydrate. What makes this benefit particularly valuable for people over 50 is the partial reversal of the natural compression process that occurs with aging. Over time, intervertebral discs lose water and elasticity, resulting in a gradual decrease in height. The dead hang not only alleviates existing pain, but also works preventively against future problems. For people who spend the day in positions that compress the spine, relief is almost immediate. Many regular practitioners report a feeling of growth after practice, and it's not an illusion. You really regain some of the height lost during the day due to decompression. A common mistake I see many people make is thinking they need to do intense exercises to relieve back pain. In reality, the passive decompression of dead hanging often offers more effective relief than many active exercises. Benefit number 2, improved shoulder health. The shoulder joint is one of the most complex in the human body, and unfortunately, also one of the most prone to injuries, especially after 50. Loss of mobility in this region is so common that many accept it as a normal part of aging, but it doesn't have to be that way. The dead hang increases shoulder joint mobility, stretching the capsule and soft tissues. This movement helps reduce stiffness and prevents common injuries after 50, such as tendinitis and bursitis. It also promotes joint lubrication. When we hang from a bar, the shoulders naturally enter a position of complete elevation. This is a range of motion we rarely use in daily life, especially at older ages. The simple act of maintaining this position passively helps preserve the joint's natural movement capacity. The beauty of this exercise lies in its ability to work the shoulder rotators in a balanced way. Most daily activities require us to use our shoulders in repetitive forward movements, creating imbalances. The dead hang helps re-establish the joint's natural balance. Physical therapists frequently recommend variations of the dead hang for shoulder rehabilitation. This happens because the exercise promotes strengthening without excessive overload, ideal for sensitive joints. An often neglected aspect is how the dead hang affects shoulder posture during the rest of the day. After hanging regularly, the muscles of the shoulder girdle learn to maintain a more aligned position, reducing the typical hunched forward shoulder posture that becomes more pronounced with age. Benefit number 3, improved circulation in the upper limbs. Blood circulation tends to become less efficient with advancing age, especially in the extremities. After 50, many people begin to feel tingling, numbness, or coldness in their hands, symptoms indicating poor circulation. The passive stretching during the dead hang opens the ribcage and promotes lung expansion. This contributes to greater respiratory capacity and better tissue oxygenation, essential for energy and vitality at older ages. When we hang, we temporarily reverse the effect of gravity on the upper limbs. Blood that normally accumulates in the hands against gravitational resistance now flows more easily. This effect is similar to what happens when we elevate our legs to reduce swelling in the feet. What many people don't know is that this exercise also causes a vasodilation response in the small vessels of the arms and hands. When you hang, blood vessels need to adapt to the new position and oxygen demands of muscles under tension, resulting in more flexible and responsive vessels. Cardiologists recognize that exercises improving peripheral circulation also benefit overall cardiovascular health. The vascular flexibility that develops in the arms and shoulders during the dead hang has a positive cascade effect for the entire circulatory system. For people who work long periods typing or performing repetitive hand movements, the dead hang offers a perfect counterpoint, helping prevent conditions like carpal tunnel syndrome and other repetitive strain injuries that become more common after 50. A sign that you're getting circulatory benefits is the sensation of warmth in your hands right after practicing the dead hang. This is a clear indication of increased blood flow to the region. Over time, many practitioners notice fewer episodes of numbness or tingling in their fingers. Before we continue, don't forget to subscribe to the channel. Having constant access to science-based information is what will make you progress with long-term health in the world of bodybuilding. Benefit number 4. Can help relieve nerve compression pain in some cases. Nerve compression is a painful condition affecting a significant percentage of the population over 50. Whether sciatica, herniated disc, or spinal stenosis, the resulting pain can be debilitating and severely limit quality of life. When nerves are compressed, whether in the spine or other anatomical narrowing points, the result is pain, tingling, and weakness. When you hang, there's a natural decompression of the nerve roots exiting the spine. The small foramina between the vertebrae through which nerves pass expand slightly. This small increase in space can be enough to relieve pressure on an irritated nerve. Another fascinating aspect is how the dead hang can help with hydration of the intervertebral discs, which tend to lose water during the day due to constant compression. The gentle traction allows them to absorb more fluid, increasing their volume and creating more space for adjacent nerve roots. Neurosurgeons frequently recommend traction techniques as complementary therapy for patients with mild to moderate nerve compression. The dead hang offers a simple and accessible way to apply these principles at home without expensive equipment or constant visits to specialists. The relief provided by the dead hang is generally not instantaneous for chronic conditions, but many practitioners report gradual improvement with consistent practice. The secret lies in regularity. Short daily sessions usually bring more lasting results than occasional long sessions. A common mistake is trying to force the body beyond comfort when seeking to relieve nerve pain. In reality, the gentle and progressive approach brings superior results. Start with short periods of suspension and gradually increase as your body adapts. To better understand this process, think of nerve compression as an elastic stretched around a finger. Even a small relief in tension can significantly restore blood flow and nerve function. This is precisely the effect that the dead hang provides to compressed nerve roots. Benefit number 5. Strengthening grip and forearms. Grip strength is one of the most reliable indicators of overall health and longevity, especially after 50. Epidemiological studies have consistently demonstrated that a strong grip is correlated with lower risk of all-cause mortality, regardless of other health factors. Holding the bar requires intense activation of the hand, wrist, and forearm muscles. Grip strength is a marker of health and longevity, associated with lower risk of falls, better functional independence, and even lower mortality in population studies. A fascinating aspect is how grip strength reflects the health of the nervous system. The muscles of the hands and forearms are controlled by nerves that travel all the way from the brain through the neck and arms. A strong grip often indicates a healthy and efficient nervous system. With aging, muscle mass loss significantly affects hand strength. This loss is not just aesthetic, but functional, affecting the ability to perform everyday tasks such as opening jars, turning doorknobs, or holding objects safely. The dead hang works the forearms in a unique way. Unlike weight exercises that normally emphasize concentric contraction, the dead hang emphasizes isometric contraction. This type of contraction is particularly effective for developing muscle endurance and neural strength. To maximize this benefit, try occasionally varying your grip width on the bar. A wider grip will emphasize different muscle fibers compared to a narrower grip. These small variations ensure complete development of the forearm muscles. A frequent mistake is underestimating how long it takes to develop significant grip strength. Be patient. Gains in this area tend to be gradual but cumulative. With consistent practice, many people notice substantial improvement in 4 to 6 weeks. Benefit number 6. Reduction of neck pain. Chronic cervical pain is almost epidemic in our technological society, especially after 50. The constant use of smartphones, computers, and long hours driving result in what specialists call text neck, an increasingly prevalent condition. When we look at our phones, drive, or work on the computer, our head tilts forward. For each inch the head moves forward, the pressure on the cervical spine increases significantly. The dead hang offers a perfect counterpoint. The body weight creates natural traction that decompresses the cervical vertebrae. The neck muscles, constantly contracted to support the head, can finally relax completely. The combination of traction and muscle relaxation provides relief that lasts much longer than simply massaging the affected area. The exercise also affects the small, deep muscles of the neck, responsible for fine stabilization of the cervical vertebrae, stimulating them to work in coordination to maintain the neutral position of the head. The beauty of this benefit lies in its passive nature. Unlike active exercises for the neck that can inadvertently increase tension in already overloaded areas, the dead hang allows gravity to do the work while you simply relax. Occupational therapists frequently recommend small breaks with stretching during the workday. The dead hang represents an extremely efficient way to combat the cumulative effects of modern postures in just a few minutes. An often neglected aspect is how relieving cervical tension affects other areas. Many tension headaches originate in the neck muscles. Regular dead hang practitioners frequently report reduction not only in cervical pain, but also in the frequency and intensity of headaches. Benefit number 7, mental training of resistance to discomfort. The psychological aspect of the dead hang is often underestimated, but represents one of the most profound benefits, especially for people over 50 facing the challenges of aging. There's a concept in Zen philosophy called shuyo, training through voluntary discomfort to strengthen the spirit. Hanging for 30 seconds, 1 minute or more isn't comfortable. There's burning in the muscles and a desire to let go. It's exactly this controlled discomfort that makes the dead hang a powerful tool for developing mental endurance. Neuroscientists have discovered that regularly practicing activities involving controlled discomfort literally alters pain processing in the brain. The neural pathways that interpret signals of effort and fatigue become less sensitive, allowing you to endure more discomfort not only during exercises, but in all areas of life. This mental resistance developed through the dead hang transfers to other aspects of life. Frequent practitioners report greater patience in stressful situations and better ability to maintain focus during challenging tasks. An interesting study from Stanford University demonstrated that regular practice of exercises involving tolerance to discomfort can significantly increase levels of endorphins, the body's natural painkillers. These neurotransmitters not only reduce the sensation of pain, but also promote feelings of well-being and even euphoria. For people over 50, this mental training offers a way to maintain psychological resilience that naturally tends to decrease with age. Many practitioners describe a renewed sense of confidence when they realize they are still capable of facing and overcoming physical challenges. What makes this benefit particularly valuable is its simplicity. Sophisticated equipment or complex techniques aren't necessary, just the willingness to remain in position when the body begins to protest. A common mistake is confusing discomfort with pain. The dead hang should produce a sensation of effort and burning in the muscles, but never acute joint pain or feelings of injury. Learning to distinguish between these signals is an important part of mental training. With regular practice, you'll notice not only an increase in the time you can stay hanging, but also greater ease in remaining calm under pressure in other situations. This transfer of skills is the true gift of the dead hang for the mind. Now that you know all the benefits of this powerful exercise, let's learn how to execute it correctly. To perform the dead hang, you only need a firm horizontal bar, high enough that your feet don't touch the ground when hanging. At home, a door bar serves perfectly, but it's also possible to use bars in parks, outdoor gyms, or conventional gyms. Start by holding the bar with palms facing forward and hands slightly wider than shoulder width. Hang completely, allowing your body to be fully suspended, with arms extended. Relax your shoulders. Don't keep them elevated near your ears. Let them sink naturally. Maintain slight activation in the core to stabilize the position, but avoid excessive tensioning of any part of the body. For beginners over 50, start with just 10 to 15 seconds at a time. If this is too challenging, it's perfectly acceptable to start with feet lightly touching the ground, supporting part of the weight while gradually developing strength. Progress slowly, increasing 5 seconds each week until reaching 30 continuous seconds. The ultimate goal may be 45 to 60 seconds for maximum benefits, but even shorter times bring significant results. As for frequency, To get the best results, practice daily. The dead hang works better as a consistent practice rather than an occasional intense exercise. Do 2 to 3 sets with 1 to 2 minutes rest between them. The best time to practice is in the morning, preferably after a brief walk or light warm-up to ensure muscles and joints are prepared. Practice is also beneficial at the end of the day to reverse the effects of compression accumulated during hours of sitting. The main mistakes to avoid include holding your breath, excessively elevating shoulders, using a grip that's too narrow or too wide, and trying to remain hanging beyond the point of extreme fatigue. Another common failure is not completely relaxing the body. Remember that decompression occurs when you allow body weight to create natural traction. If you liked this and want to discover another exercise like the dead hang, where we stay in the same position, capable of healing the body from years of neglect, we have a video appearing right now on the screen showing everything better about this other exercise. Don't miss it. Thank you for watching this far, and may God bless you, my friend.